McMaster. Welcome to this special edition of our Mac and Tobacco commentaries and information on tobacco and other addiction topics. This edition is Addiction Treatment Breakthrough, treating nicotine dependence as a primary or as a co-occurring substance use disorder in addiction treatment. Include tobacco and nicotine dependence into traditional addiction treatment? They said it cannot be done. They said it should not be done. Norma Medulan said, let's do it, and so she did, and her Canadian addiction treatment team did it at the Newport Centre in Port Colborne, Ontario, and it's still successfully treating nicotine use as a primary and as a co-occurring addiction in their program. This Mac on Tobacco video podcast shares Norma Medulan's story and reveals her contribution to addiction treatment. First, here's some background. Tobacco and nicotine have long been orphans when it comes to dealing with the 12 identified and treatable substance use disorders eligible for treatment, rehab, and funding as medical conditions. Substance use disorders is a new term that describes addiction, chemical dependence, alcoholism, and other descriptive labels common in public health language. Nicotine dependence has not been identified and treated in our traditional addiction treatment services. Tobacco and nicotine are seen as being different from alcohol and other drug addiction and not within the scopes of practice of addiction professionals. We now believe those suffering from alcohol and other drug dependence that are also dependent on nicotine as smokers and users of smokeless tobacco are in the largest block of current cigarette smokers and tobacco users. We believe they are getting sick and dying from tobacco at up to 4 times or more times the rate of those dying from tobacco in the general population. They are vulnerable and at high risk for tobacco-related and cause diseases that take 200,000 or 44% of the 430,000 Americans that die from tobacco every year. Denying those suffering from nicotine dependence equal addiction treatment services that are readily available to people with alcohol and other drug dependence is obviously discrimination. It is even more disturbing to know those most qualified to treat nicotine dependence, addiction counselors, addictionologists, and other addiction specialists do not include nicotine dependence when they are treating the other identified 11 substance use disorders in their programs. Nicotine-dependent individuals are not eligible to receive inpatient, residential, intensive outpatient, day treatment, halfway house, and other supportive services. They're part of our comprehensive addiction services. Tobacco takes more lives than alcohol, other drugs, suicide, homicide, traffic deaths, and AIDS combined. Yet this most deadly of all drugs in terms of mortality is ignored and exempt from traditional addiction services. And health insurance providers do not insist nicotine dependence be treated as other addictions are in licensed addiction treatment programs. We have found one, and only one so far, comprehensive addiction treatment programs that will admit individuals with the primary diagnosis of nicotine dependence into their residential or inpatient programs. We could find no United States program that has this inclusive admissions policy. We found one in Canada. This Mac and Tobacco video shares the story of the Newport Centre in Port Colborne, Ontario, as told by the courageous pioneer manager that made it happen in the Newport Centre, an 18-day inpatient residential program. This addiction treatment pioneer is Norma Medulan. Norma introduced the Newport Tobacco Integration Program, and she was the regional director of addiction programs in the Niagara Health System. The Newport Centre is located in the small city of Port Colborne, Ontario, on the eastern shore of Lake Erie, not far from Niagara Falls. In this video, Norma's comments offer details of her tobacco integration work at the Newport Centre. Newport Centre is one of the comprehensive addiction services that operate in the Niagara region. These comments were videotaped at Norma's home in St. Catharines, Ontario. We thank Norma for her pioneering breakthrough, her leadership in bringing tobacco integration into our regular integration services for those with a primary diagnosis of nicotine dependence, and her generosity for sharing her story with us. Norma told us her family motto is, if you can help, why not? Her story shows Norma does live by her family motto. Please meet a truly remarkable woman, Norma Medulan, tobacco integration pioneer.
The organization that I was working for at the time had made a decision to go smoke-free property-wide, and I was involved in that committee to see the best ways to go about that and what we could do for the hospital patients in particular. But because I was the regional director of addiction programs, it also fell to me to look to see how we were going to manage that whole strategy with respect to no smoking property-wide for all of my in and outpatient programs and addictions. And when we were dancing around all the permutations and computations about what this could or could not look like, it occurred to me that we were doing far more work trying to enable people than we were trying to help them. And that is because there's no way that any addiction program was going to send their clients across the street for a nip of gin or a line of cocaine. And so I couldn't make it reconcile for myself. Why would we be sending people across the street in order to get around the smoke-free property-wide in order for them to have to use their tobacco? That's one of their biggest addictions, and what were we trying to do as a system? What were we doing? And that's really where it came from. What is it that we're afraid of? Why can't we do what's right, not what's easy? And so we began. Well, I had a number of programs under my responsibility, under my portfolio, and Newport was the, most people would know it as 28 days, but it's actually an 18-day inpatient rehab program. And so, although all of the programs, the withdrawal management services, or people know that it's detoxes, also went no smoking, and we would treat the withdrawal through various nicotine replacement therapies. When we look at what's going on at Newport, that's a long-term stay. And so that gave us an opportunity to really help people make a change in their behavior. And we looked at what it was that was the program content, and I asked the question to staff, what's different? What would we have to do differently? And we really didn't have any good answers, because addiction is addiction. And so we integrated it. We had to do some pretty tough things. We changed how we did the program, in so much as the client used to go for walks off property, and I ended that. And we used to have a lot of visitation, and I ended that. And I termed it treatment immersion and gave it a different focus. Treatment immersion means that you're here to work on you without outside distractions. That's the whole premise of an inpatient program. And so we moved the, the tobacco treatment, we just merged it with everything else we were doing. We had to do a lot of background work to make sure that our referral agents were understanding what we were trying to do, that the clients understood, that the physicians in the community understood, and we received quite a bit of resistance, but we persevered. I didn't find another program that did what we were going to do, and so we started out. We began to be the pioneers and thought, let's take this strategy and see where we can take it. We were open to making amendments where we needed to, and we knew that we didn't have all the answers, but we knew where we were going, and so go we did. It's a simple phone call from a client in the community who said, I heard about your program. Everybody knows about Newport. Understand you're now letting, you're treating the tobacco thing. I don't have an alcohol problem. I don't even drink, but I smoke. Can I come in? And I said yes. It just made sense. And I said yes. They did quite well because they were motivated. Like any treatment, you've got to bring some willpower, and you've got to bring some self-motivation to the table. You've got to come with something. And she wasn't pre-contemplative. She was in action stage, and she was prepared. And so it was interesting to watch that dynamic. And as we built a small cohort of people who wanted to do the same thing, we knew we had something, that there's an awful lot of public health strategies that go into the issue of tobacco. Even our own Ministry of Health for a long time forbade the addiction treatment system from treating tobacco addiction because they saw it as being the venue or the purview of public health. And I was fairly active in provincial meetings and roles and with the ministry, and so I took it to them and I said, we can do this and it isn't going to cost any more money. And of course, every government that funds anything is excited to know that you can do it without any additional money. And we could. I said, if not us, who? Who? We are the addiction treatment experts. Why are we making people jump through hoops and loops? If you have an addiction, why are we not allowed to help you with that? So there were no good answers. And so we continued. I mean, when you think about the cost benefit to treating a tobacco addiction alongside all of the individual's other addictions, how can you not do that? It just makes no financial sense. So there were some startup costs in terms of some of the staff felt like they needed some additional sort of understanding and training, and we got that for them, but it didn't cost us any money. There was already the Center for Addiction and Mental Health who were doing that, so we got easier access for our staff to go, so that was easy. And we began. We needed to find funds to have on board nicotine replacement therapies because we're not cruel. We understand the withdrawal. It's what we do in the detox. So we helped people get the patch, the gum, the puffer, whatever they needed in order to manage the withdrawal. Just like we give Valium if somebody is in severe alcohol withdrawal and we don't want you to go into the DTs. So we manage your withdrawal, but these are not meant as crutches. These are meant as helping aids to get to where we want to go. And so we needed some funding for that, and by Jove, it always comes, eh? There we are. I think the highlight for me was that we met with tremendous resistance from people that we least expected to get resistance from, and they began to be our strongest advocates. And that's a highlight for me. When I had a colleague in the province call me out in a public meeting saying, "You're mean, this is crazy, under what authority?" And a year and a half later call me and say, "Can you come up and teach us how to do this? You're brilliant." And it wasn't about being brilliant, but it was about having a vision, being strong enough to take it forward. And that's a highlight for me. As tobacco addiction becomes much more in the forefront, people really have to start wrestling with the fact that the old adages don't work. They are outdated, and we can do better, and we do better. So that is an absolute highlight. That staff of ours were willing to work with this, even though some of them really had some questions about, whether or not I was firing on all cylinders. But it was okay because everybody's opinion counts, and you need to keep those people close to you so you can learn from them what their anxieties are so that you can help to moderate the changes. If you push them away, you have nothing but airspace, and that's not going to help. So bring them closer, understand, learn, move forward. There was a real feeling that it was all they had, and I find that, and I use the current term, I find that so distasteful. How paternalistic is it to make a decision that our clients don't have it in them to try or to do this? So I got huge resistance from that. Some of the doctors, surprisingly, were very resistant because they didn't want to be bothered with having to prescribe anything, Champex or NRTs or whatever else was available, and the doctor decided they didn't want that. They saw it as harmless. I was shocked that one of the orthopedic surgeons was not in favor. And we know that tobacco use weakens your bones, but you can leave it to yourself to decide why he decided that wouldn't be a necessary thing, that he wasn't going to have a kid in the hospital who had broken his entire leg in a bunch of places not be able to smoke a cigarette. He was underage and he had fractured his entire leg, and yet the doctors felt, oh well, it's all he's got. I hope we have more than like a piece of cigarette to keep us company. I hope we have more than that in our life. And I believe that every client has the right to best optimal health. I will also say to the naysayers that the first addiction that our clients have, and I will say 97% of those who smoke will tell you that it was cigarettes that were their first addiction. They start off in grandpa's basement, swiping a couple of cigarettes and moving off into the woods or up into the apartment to smoke. It is their first addiction. So why is it that we don't feel that we should treat the first addiction first? Why is it that we feel that we should put that off until the end? I believe that if our clients can manage, and they can, their tobacco addiction, how much easier is it going to be for them to be able to manage all of their other addictions? They will have managed their biggest addiction first, and the rest will come easy. And we saw it happen, and it is exhilarating for those clients that know that. And we also know if we don't treat the tobacco addiction, alcohol follows. Cigarettes and smoking, coffee and smoking. Most activities went with smoking. They couldn't join a rec league. There were all kinds of things, and so it makes no sense. We know that the ash in an ashtray can be a trigger for those using heroin or cocaine, and the ashes are a trigger. We know those things. We know those things. And yet we are blindly walking away from the biggest contribution that the addiction treatment system can make. And we're nervous. And my question is why? We're worried about if our numbers will drop. I will tell you my numbers dropped. And my staff were nervous. And I said, what we're going to do with that right now is we obviously need to do more education. But right now, we're going to really give good concentration to those clients that are in our program. And they will be our best advocates. And we were right. Because the best publicity you can get is a successful client. So why not? What are we afraid of?
Thank you for watching this special Mac on Tobacco video presentation with Norma Medulan. We presented some of the challenges faced when we begin to integrate evidence-based nicotine or tobacco dependence treatment into our behavioral health services. If you are wondering or reading about the term behavioral health and wondering what behavioral health is a term that includes both mental health or psychiatric services and addiction or substance use services under the same umbrella. There are many skeptics that have believed we can't or shouldn't treat nicotine and tobacco dependence in our addiction and mental health services. The tobacco integration experience Norma Medulan has shared with us demonstrates that it can be done and is being done successfully at the Newport Center. Tobacco integration is catching on at the state and national level. Finally, we have addiction treatment programs in Wisconsin that have successfully implemented 100% tobacco-free programs that treat nicotine dependence concurrently with the treatment of all the other substance use disorders. This is encouraging and deserves our support. However, we cannot be satisfied to have only one addiction program with comprehensive levels of care that will accept and treat those with a primary diagnosis of nicotine dependence, or 305.1. Thank you, Norma, and your Newport Center team for blazing the trail for us to follow. This is David McMaster for Mac on Tobacco. Thank you for your interest and support of our tobacco and addiction commentaries.